How do you make the diagnosis of an eosinophilic gastrointestinal disease? For all of the eosinophilic gastrointestinal diseases, it includes eosinophilic esophagitis, and endoscopy is part of the diagnostic procedures. The reason for that is that any of these diseases are what we call clinico-pathological diagnoses, meaning you have symptoms, the clinical part, and then pathological, which means you need to have histology or tissue. So you come in with a symptom, and you also need to have an endoscopy to understand that we can look at the tissue to try to correlate whether those two match. The diagnosis itself is based on appropriate symptoms, so we want to make sure that the symptoms match with the tissue abnormality. And what I mean by that is, if you have problems swallowing, you want to have an upper endoscopy to look at your esophagus and see if there's inflammation there. If you're having diarrhea, then the examination of the endoscopy may not really match the symptom of diarrhea. So you want to make sure the two of those match. When we look at the tissue, we're trying to understand, are there a threshold number of eosinophils that may be abnormal for the esophagus because it has no eosinophils? That would mean that there are some present. Up to 15 is what we've established as a part of the consensus recommendations. For the rest of the intestinal tract, including the stomach, small intestine, and colon, the numbers that define abnormal are a point of discussion, and I think a discussion with the pathologist is important to have to see whether those really meet threshold for an abnormal number.